Good evening and welcome. This is Marilyn Shannon. This is the Breaking Free Show. This is Monday night, and what an exciting week ahead we have. It's Thanksgiving, and I know for myself I'm really excited, and I think there's an excitement in the air. I don't think there's anybody that I have spoken to recently that is not excited about this holiday and this one in particular. We have so much to be thankful for. So I want to just let all of you know out there that I am very thankful for you. I'm thankful for all of our previous guests that we've had and all the future ones that don't even know they're coming on yet. And I'm thankful for all of my friends that are on the chat and all the ones that will be coming. And I'm thankful for Amnon.
You're welcome.
And thank you, Amnon, for everything that you do for us here and providing us this marvelous space and time. So I have a quote that I want to share with all of you tonight. And I read it on the previous show, and I'm going to read it again because I love it. So it goes like this. If the only prayer you said in your whole life was thank you, that would suffice. Meister Eckhart. And I just loved it. So I wanted to share it with you because I think this is a time for us to be thankful. Somebody the other day said they were feeling great. And they're having this marvelous experience with something, and they don't want the feeling to end. And so we talked about, well, how do you keep a good feeling going? How do you keep a marvelous experience, whether it's a new job or something extraordinary? How do you keep it going? Very simply, you say thank you. You be grateful. You appreciate the moments. That's the best way to keep something extraordinary happening so you can keep on floating with it. That helps keep us grounded, and yet we don't lose the opportunity. So say thank you. Tonight is a very special night, and I really want to thank Chris, and she's on the chat because she really did a great job in helping us get our guest tonight scheduled. So I really want to thank her very, very much because we really love to have all kinds of people with all kinds of stories, whether it's a tool or a strategy, whether it's a life experience, whether it's an invention, just all kinds of people on our show to talk about breaking free in all aspects of life. And tonight we have this really special woman on who has recently done a TED Talk. And if you all know about TED Talks, if you don't, you should. Go look at them. They're fabulous. They're 18-minute talks given by people about all kinds of ideas. Their tagline is ideas worth spreading, and they are. It could be something emotional. It could be some kind of technology. It could be some program in Timbuktu. They're just extraordinary. And we have the pleasure tonight to have on Dr. Elyn Saks with us, and we're going to be calling her in just a moment. But Elyn Saks is Associate Dean and Orrin B. Evans Professor of Law, Psychology and Psychiatry, and the Behavior Sciences at the University of Southern California, Gould Law School, and an expert in mental health law. She suffers from schizophrenia and has written about her experience with the illness in her autobiography, The Center Cannot Hold: My Journey Through Madness, published by Hyperion Books in 2007. Saks says, there's a tremendous need to implode the myths of mental illness. Yay, that's my word. To put a face on it, to show people that a diagnosis does not have to lead to a painful and oblique life. In recent years, researchers have begun talking about mental health care in the same way addiction specialists speak about recovery, the lifelong journey of self-treatment and discipline that guides substance abuse programs. The idea remains controversial. Managing a severe mental illness is more complicated than simply avoiding certain behaviors. Approaches include medication, usually, therapy, often, a measure of good luck, always, and most of all, the inner strength to manage one's demons, if not banish them. That strength can come from any number of places. These former patients say love, forgiveness, faith in God, a lifelong friendship. Saks says, We who struggle with these disorders can lead full, happy, productive lives if we have the right resources. In June of 2012, Saks gave a TED Talk advocating for compassion towards people with mental illness. And I am delighted to have her on the show tonight. Have we got her? No.
Yes. Thank you very much, Marilyn, for that lovely introduction.
Well, without really having spoken to you yet, you have just absolutely touched my heart.
Well, thank you.
So I appreciate your being here, and I not just being here, but I appreciate your being out there and doing what you're doing. So
a lot of people warned me against it. They said that I want to become known as the schizophrenic with the job. I should do it under my book under a pseudonym, but I thought that sent the wrong message, that this was so awful you couldn't even say it out loud. So I took the risk and became public, and it's turned out to be incredibly rewarding and gratifying because I get lots of people thanking me, and it makes me feel great.
Yeah, I guess, there are a lot of people who are scared of a lot of things, and they impose that fear on other people, but not realizing how strong you really are, and to have gone through what you've gone through, you have a strength that probably many of us would never even know about.
I'm not sure about that. I think I've had a lot of luck in the form of really great resources to help me. I'm not like a lone woman who overcame odds through sheer force of will. I had a great treatment, wonderful family and friends, wonderful workplace. Lots of things came together to help me, do okay.
Well, I know that we want to ask you this one first question. So, and with the way we operate, we kind of have this conversation, and I'll ask you some questions, and then, you can just take off and go. So, what was it like to have a psychotic episode?
Psychotic episode, the best analogy I can think of is like a waking nightmare. So you have all the bizarre images and frightening things and violence. Only unlike with a nightmare where you can sit up in bed and wake up, you can't make a psychotic episode go away just by opening your eyes. And for me, schizophrenia, a lot of people think schizophrenia is split personality, but actually the schizophrenic mind is not split but shattered. I have delusions, which are fixed and false beliefs that aren't responsive to evidence, like that I've killed hundreds of thousands with my thoughts. I have occasional hallucinations, seeing a man stand with a raised knife. Disorganized thinking. So I had a breakdown on the roof at the Yale Law School when I was my first year at Yale. And I told my friend, I said, my copies of the cases have been infiltrated. We've got a case of joint. I don't believe in joints, but they do hold your body together. So words that are loosely connected but put together make no sense. Fortunately, I've been spared what are called the negative symptoms of schizophrenia, except the first 2 years I was ill, and that would be apathy and withdrawal and inability to have friends and inability to work. So I have had what they call positive symptoms, but very little in the way of negative symptoms.
Mm-hmm. And I don't know if I could say for most people, but can you generalize at what age schizophrenia could start to appear, whether it's...
there are some really early onset cases. There's a girl named Janie here in L.A. who developed schizophrenia at the age of 5 or 6. Typically, boys break in their late teens and girls in their early 20s, which is exactly what happened with me. In my early 20s, I fell apart.
Mm-hmm. So you've been dealing with this for a long time.
A long time.
Yeah. A long time. And so what was it, that really was the window, I guess, of opportunity for you to begin to really come out and, let's say, do the TED Talk?
Well, again, I started being ill in 1977, so it's been a long time. And the last time I was hospitalized was 82, 83, which is, in a way, my proudest accomplishment to have stayed out of the hospital so long. So I first became ill in the late 70s. And I was in psychoanalytic treatment, which helped me in a lot of ways. But eventually I got into another therapy, and my doctor put me on medication, which I resisted for many years. I tried many times to get off of it. But eventually reconciled to being on it, and it's made my life a lot better. I like to say that mental illness and treatment raises lots of interesting and difficult philosophical issues, and I believe mental illness is an illness, a chemical imbalance that needs medication and therapy, but I take that view for pragmatic reasons because it works for me. And other people, it may work for them to think that they just have an alternative way of being that they embrace and adopt, and it's not an illness. Right.
So, you just described a few things, but is there anything else that had helped you in terms of of psychoanalysis?
Well, the analysis, a lot of people think that you should not use analysis with people with psychosis, and I disagree. I think a lot of people you shouldn't, but some people you should, and we need to develop techniques to determine who that is and then give them this because it can make such the difference between a really good life and a really bad life. But for me, the analysis works in a number of ways. First of all, all illnesses are responsive to stress, especially mental illness. So being able to identify your stressors and either avoid them or cope with them is important. Second, it fortifies a, quote, observing ego, your ability to stand back and observe what's going on in your mind and assess it. Third, it's a safe place to bring your dangerous and violent and scary thoughts so you don't have to say them in the outside world, so to speak. Fourth, interpretations can detoxify symptoms. So like I had a doctor once say to me, you're saying violent things, I think, because you're really scared. The violence is your defense against fear, and that made sense to me, and the symptom went away. And then finally, you have a benign and smart and caring person who accepts you not only for the good but the bad and the ugly as well, and that's enormously empowering, I think. So all those things come together and really helped me, navigate my symptoms and come to have a really good life for myself. But I think I really, I still go 5 days a week. I've been trained in psychoanalysis, the research part, and I know the theory, which is that termination is part of the process, but I think of myself as a lifer because I'm afraid to stop, to tell you the truth. Mm-hmm. Last time I tried to stop, I ended up in a hospital for 5 months.
Mm-hmm. Right, the TED Talk was done when? What year was that?
Mid-June, just this year, 2012.
Right. And you often alluded to your husband in the audience, I saw.
Yes. One of the best things that ever happened to me was meeting and developing a relationship with my husband, Will. We married when we were in our 40s, and we kid around that we just skipped the first marriage.
Yes.
Went straight to the second marriage. But he's enormously supportive and loving and helpful, and it really enriches my life and helps me navigate in the face of symptoms and so on. But I think that's one of the best things that ever happened to me, and one of the luckiest things, because a lot of people don't get that.
Well, it sounds like he's a very fortunate man as well. And
thank you.
And what you were talking about before about basically being surrounded by
right.
caring people. I mean, that makes a huge difference.
Totally. Mm. I know people have told friends, and the friends disappear, and I've been lucky that I've had friends who've stayed the course and stayed with me and worked with me and supported me and enjoyed things together and grieved things together, and it's one of the things that sometimes people with schizophrenia don't have, which is friendships. And sometimes people ask me, how did I manage that? And I don't really know the answer, except that to have a friend is to be a friend. Mm-hmm. That's one of the things I'm luckiest in about this illness, is that I have really good relationships, both romantic and friendship and family.
Right. Well, I guess I don't always believe that everything happened. I believe that things happen for a reason, mm-hmm. and that some things can be by accident, but a lot of things happen for a reason. And for me, I would say that you've been helped with these wonderful friends and family, so that you would have just a bit more strength to come out and do what you have
right.
to do.
Right. Absolutely.
So we have a question on our chat, and it's
okay.
They want to know, like, what did you notice on the onset, or maybe not so much on the onset, but as you were getting into the schizophrenia, what did you notice that led you to realize something was not exactly right?
When I first became ill, it started out looking like severe depression, which over time it became more of a thought disorder than a mood disorder. But I noticed that I was depressed. It was hard to avoid it. I had a hard time getting out of bed in the morning and that kind of thing. And what I was initially treated for was depression. I was hospitalized for a month, and then a year later for 4 months. And I had depressive symptoms, and I started having psychotic symptoms too, which I hid from the doctors. I thought that I was being given commands to do certain things and that kind of thing. And then when I got into psychoanalysis, it really helped me start being able to work again and make friends again. So that was a really positive thing. But I also started having a lot of delusions and hallucinations. And the therapist pointed that out. So I knew, I knew that it looked like I was becoming mentally ill. I didn't really believe I was, but I knew that it looked like I was because I had, people telling me that, basically. Mm-hmm. I've always had what you might call social judgment, which is to say that even if I thought what I was believing was right and that I had a special premium on the truth, I always knew when other people would think it was crazy. And I didn't want to appear crazy, so I either didn't say it out loud, or if I felt like I couldn't not say it out loud, I stayed home. So I was able to make my way in the school and professional world, even in the face of the illness, because I had this social judgment.
Mm-hmm. So other individuals that also have chronic schizophrenia, is it there varying degrees of that social part? Yeah.
A lot of people with chronic schizophrenia have hard times making friends and making relationships, romantic relationships. That's a very typical symptom of schizophrenia, and again, one that I've been blessed not to have. Okay, good. Now I have another question. I want to know, is there a difference between schizophrenia and schizoaffective disorder? Yeah, schizoaffective disorder shares things with schizophrenia and mood disorders. So people who have schizoaffective disorder have high and low moods and also psychotic symptoms. And there has to be a period of psychotic symptoms absent a mood component. And people with schizophrenia have a thought disorder. They have delusions and hallucinations, but they don't have high or low moods. They may have labile moods where they get revved up or upset or whatever. But it's not like a sustained period of euphoria or depression. Schizophrenia has a worse prognosis than schizoaffective disorder, but schizoaffective disorder has a worse prognosis than a pure mood disorder. Okay. Well, that's a mouthful, isn't it? Yeah. So when you're speaking, who's your audience? Is it a family member? Is it society in general? To understand? Gosh, it's anyone who will listen. Anybody who'll listen. Right. Yeah, I think we need to try to make things better for people with mental illness. So anybody who would listen would be a great audience for me. And how are we doing? I think things are better than they used to be, but they're still not as good as they could be. Mm-hmm. I mean, as an example of stigma, I talk about internalized stigma. Glenn Close, the actress, asked me to be on her board of her organization, Bring Change to Mind. Her sister, Jessie, has bipolar illness, and her nephew has schizoaffective disorder. And she gave me a T-shirt that was playing off of a public service announcement she gave with people wearing T-shirts, and mine said schizophrenia. And the thought I had was, well, I don't really wear T-shirts to work, but I do wear them on weekends to work. And then I thought, but do I really want to wear a T-shirt that says schizophrenia? And then I thought to myself, people with cancer wear bracelets, pink bracelets and pink shirts and stuff like that, and are very proud, and there's a lot of solidarity. Why shouldn't it be the same with schizophrenia as it is with cancer? But even for myself, someone who should know better, it's not the same. Mm. And that's very interesting because, in some regard, I feel the same way about a lot of the work that I do. I want to kind of commercialize things to a degree. So it takes the stigma out, it takes the fear out, it makes it more common to some degree. Yeah. And I agree. And I guess that's kind of like what you're doing. And I think that was brilliant to be able to do that, to look at it. And I'm listening to you now, and I know that the thing is the problem is the fear that right. we have, whether it's about whether it's contagious, we think it's contagious, right. Right.
or everybody with mental illness is going to kill somebody, or there's so many stigmas, so much that we and bipolar. I mean, you mentioned bipolar, and that's seems so common today.
Right. Right.
I mean,
much more open. People are much more open about it. It's much more common.
It is, and I mean, I watch a soap opera. I hate to say this, but I do, and they're touching upon a character with, that's bipolar that's been on for years and years, and it's
really,
I mean, and it's what has to happen. I believe.
Right. Yeah. Where does stigma come from? I mean, part of it is we always have out groups that we want to distinguish ourselves from. Part of it may be that we blame the mentally ill person in the same way that we wouldn't blame someone with mental retardation. And part of it may be guilt feelings like, oh, did I do something wrong? And then I agree with you that part of it is a kind of unconscious fantasy of contagion. If I stay around this person, it's going to happen to me, which, of course, is not realistic at all. But all those things come together. After the Gerald Loeffner case, the guy who killed several people and wounded the congresswoman, one of my colleagues said to me, if this boy had been bleeding copiously from the nose, his parents would have brought him to the ER whether he wanted to go or not, and there were lots of warning signs and symptoms. And either they didn't see it or they didn't want to see it, but the results can be tragic. Mm-hmm. And, obviously it's tragic when someone kills someone, but it's also tragic when someone who could be helped doesn't get help because of stigma. People shouldn't have to suffer, but they will if they don't get help, and stigma prevents a lot of people from getting help.
Yeah, I guess it's also the awareness. I mean, we look at people in a wheelchair, and as you said, if your nose is bloody, and we can...
I'm sorry, you're breaking up. Say that again, please.
No, I said, you were saying something about, bleeding from the nose, and if somebody's in a wheelchair, you can see a disability, you can see an illness, but mental illness you cannot see. And just like I was reading in your bio, people expect you to just, why can't you do it differently? Why can't you just change? Well, you can't.
Right, exactly.
So we need a whole new way of looking at mental illness with what you're doing.
Thank you.
I want to. I know that there are people who have questions and they're writing on the chat, so I'm gonna read them as best as I can. But I also want to. And are you okay with people calling in too?
Sure, that'd be fine.
Okay, so if anybody would like to call in, our number is 919-518-9773. You're more than welcome to call in and ask the questions that you have on your mind and on your heart. Let's see. There's a question here. Let's see. Just give me 1 second. I'm just trying. Is there a conflict of Is there a conflict of interest for? Let's see. I can't make out this question. I don't think. I'm assuming, given her field of expertise, JB, giving her field of expertise and life experience, and it's going so fast. Can you see it? And the law. Is there any kind of conflict of interest for you with mental illness and what you do?
So basically, when I make recommendations for policy and mental health, do I really have a conflict of interest since I have a mental health issue myself?
Yes.
I actually think, I see mental health issues kind of from all sides of the medication counter. I've been a teacher about mental illness. I've represented people as a lawyer with mental illness. I write about mental illness. I've treated patients in connection with my psychoanalytic training, and I'm a patient myself. And I like to think that all those different points of view inform what I try to do and try to recommend in terms of policy. And I do make recommendations that wouldn't have helped me, but I think they're the right recommendations in the long run. So I think the answer is, that I hope that the different perspectives I have lead to sound and good policy judgments. There's always a possibility of, misperception because of my illness, which I'm mindful of and try to, make sure it doesn't happen.
Okay. And then we have somebody that had to leave the chat, and she wanted to let you know that she was very grateful for you being here.
Oh, thank you.
You're welcome. The other question is, do we have somebody on the call? Okay. We have a phone caller. Hello. Hello?
Hi.
Hi. Can you speak up a little bit louder?
Hi. Actually, this is JB. I just wanted to clarify. Can you hear me?
Yes, definitely. Go right ahead.
Sure. Dr. Saks, I just wanted to clarify my question because I was not implying at all that I thought there was a conflict of interest with you teaching. My question was there a conflict of interest if your law students come to you and share with you their stories and concerns when you're actually teaching them and have to grade them in whatever substantive course you're teaching?
Yeah, as someone who's, quote, out with a mental illness, I do get students who come to me and reveal their situation and that kind of thing. And I try to be as helpful as I can to them, and some of them we counsel to maybe take some time off, and some of them get more supports in place. I hope it doesn't affect my ability to grade. I mean, in fact, we have a policy here at USC of blind grading. So when I'm looking at exams, I don't know who wrote them anyway. I don't get the grades until after I've finished all the exams and the grades have been entered. Can't do that with papers. So I don't, I like to think I'm a resource to students and helpful to students, and I'm hoping that it doesn't, bias me when I'm grading their work and it's not blind.
Thank you. I just wanted to make sure you
okay, I misunderstood your question. Okay,
thanks.
And thank you for calling in and clarifying that. The chat was going so fast I couldn't see the whole concept, but I really appreciate you calling in.
Me too.
JV, was there anything else you wanted to ask? Oh, she's gone. Okay. And if you do, JV, want to ask anything else, please feel free to either call back or put it on the chat, and we'll do our best to capture it. So thank you very much. So what about public policies? I know that you, Chris, sent me a message to make sure that we spoke about that as well, about your wish list.
So my wish list, two basic things, which is step up to the plate and provide resources so people can do well. I'm doing well, but I've had enormous resources invested in me, and we need to do that for other people, provide better treatment, more timely treatment, and that kind of thing. And then the second thing is, I think, studying ways to use force less. I've come to say I'm pro-psychiatry but anti-force, and I think we need to study ways to get people to want treatment so we don't have to use force. Mm-hmm. And that will require, lots of careful and extensive studies. So those are the two prongs of obviously, if I could wave a magic wand and make all mental illnesses appear, that would be it. But in terms of things that it's realistic to do, providing resources and studying force would be my two, and I guess trying to decrease stigma, because stigma gets in the way of everything. Right.
So, so I know I asked you earlier if you thought it was getting better, and you thought that it was. Is there an increase in mental illness now?
Not that I know of, but I haven't really studied that question.
Okay. I know a lot of people, I don't know if it's just becoming more apparent that we hear more about.
My understanding is the stats are that 25% of people have a mental health diagnosis and 10% it's serious, but that's just a figure I heard, and I haven't read a study saying that.
Here is a question. As a person who has contact with many people with schizophrenia, have you noticed any common ground, commonality, initiating factors, age of onset, or triggers?
I don't really have enough information. One thing is people say I'm unique, but, I'm doing this study at USC and UCLA with 20 people who are high-functioning people with schizophrenia. We've got 2 MDs, a PhD candidate in psychology, a JD, a CEO of a not-for-profit, full-time teacher, full-time parents. So there are other people like me. It's just so stigmatizing that they don't really come forward. So that's, something I have studied. In terms of typical age of onset and course and stuff like that, I don't feel capable of answering.
I appreciate that. So do you work with other individuals with schizophrenia as far as in doing the research and public policy and so forth?
Say the question again. What about other people?
Are you engaged with other individuals with that are have schizophrenia in the work that you do as well?
Yeah, I've made some friends who have schizophrenia. One is a PhD psychologist at the Department of Mental Health, and one runs a peer support group, and so there are other people. There's a guy, Fred Fries, out in Ohio, who's a PhD psychologist. So I do kind of hang out with some of those people, and I'm actually writing a book with a bipolar lawyer, kind of joint memoir about our experiences. So I do kind of collaborate with, and I've got this new institute, the Saks Institute for Mental Health Law Policy and Ethics, and we pick a topic a year, and every year we invite at least one or more consumers to opine about what we're studying or talking about. And I think it's important to give the consumer a voice in these issues. I mean, we're one of the key players, so we should be at the table as well.
Yeah, I mean, definitely, because I mean that's a big audience, isn't it?
Yeah, for sure.
I mean, you want to know what even in this with the stigmas. I mean, we, in order to see where it's coming from and to be able to address it.
Right.
JB has
actually there's evidence that like getting people to see that mental illness is a brain disease doesn't reduce stigma, but becoming acquainted with someone who has the illness can result in decreased stigma. So my hope is that by coming out and maybe other people being encouraged to come out, we'll be able to reduce stigma more.
Mm-hmm.
Easy for me to say I have a job with tenure, but
no, but you're so right, because I mean, when you don't know someone, here we are, my audience, myself, we all are having an opportunity to get to know you.
Mm-hmm.
We have a picture with a voice. We're hearing you speak. It's setting a whole new, a whole new idea about this. I mean, it's really, and you're so right. If you don't know someone, and if you have no firsthand connection,
right,
to some, how do you know other than what
I
might read?
I actually have a friend at the law school who was an administrator, and she basically came to me and she said, "I'm glad I didn't know you had schizophrenia before we started going out to dinner." And I said, "Why?" And she said, "I never would have gone to dinner with you." So this is a smart, kind, empathic, caring person who harbors such misperceptions about schizophrenia that she wouldn't even have dinner with me. I mean, I think that says a lot. I was glad that she felt like she could tell me that, but it was just kind of upsetting to hear that she actually thought that. And I think probably a lot of people do, well-meaning, not bad people, but just,
Right.
And I think that I'm glad that you're doing this show, and I think the press should step up to the plate and try to portray mental illness and all its complexity and diversity, and not just when someone commits a crime. Right.
Right. No, it's so true. And when you're talking about this lady, I mean, and it's so it's good to know that she was. That she could tell the truth,
right?
Because that's so important to all of us to hear that. Because
right.
I'm sure there's many of us out there that would say the same thing,
right?
On some level,
right.
Or that would go, but would be, kind of scared to go, or wonder what are we going to find when we get there. When
right.
you think about somebody with schizophrenia as a regular person, like myself, and
exactly.
You have no idea what you're getting, or who they
right.
are, and what is it. My picture of schizophrenia is maybe you at when you're not on your meds, or you at your worst.
Right.
But you need your meds to have a quality of life. Totally. Very different than what the rest of us might need, but nonetheless, maybe totally a different degree. But we all need something to have a quality of life.
Right.
And
I think my story speaks to a lot of people, even who don't have mental illness or mental illness in the family, because everybody has something. People have struggles, people have difficulties, people have challenges. And it's not only people with mental illness, it's all people.
Right. And it's time that we, as a human race, really embraced all of us and learned, because look at what you've accomplished. I mean, you're not somebody sitting up in a room, in a one room shanty somewhere with just a sofa staring at a TV.
Right.
I mean, you've accomplished extraordinary things, and you're coming out here now and you're sharing all this with the rest of us, and I want to keep sharing this show, you know, and talking about it, because I mean, I now have a totally new concept of my misconception.
Wow, that makes me feel great.
Well, thank you. I mean, I have to tell you, we've been really so looking forward to you being here. I mean, Chris and I kept saying, when she's coming, Doctor. I mean, we've been so happy about the opportunity to share this. You know,
Thanks.
it really is an honor. And and there's so much going on in the chat. I'm just going to say, if you know, please write. I know that there's so much conversation. I know you're not seeing it. There's so much statistics, and people are talking about so many things that I will tell you, you have sparked such a conversation that you may not see it, and I probably can't catch it either because it's going so fast, but it's really good. But it's really good.
That's great. That's great. Yeah. It sounds like a lot of people are listening.
There are a lot of people. Yeah, there's definitely a lot of things going on in our chat, so I'm glad. That's a world in itself right now. But, you know, I mean, that's what you're helping to create. And you're not going to be able to be everywhere, see all, hear everything, but your message can certainly wake people up to another way of thinking. I know somebody that we've known for a lot of years who is somehow a member of our family connected through marriage, and I know that this person is schizophrenic, and you know, but I've stayed away because of my fear and what other people have said, and you know all those things. And this person's married.
The key message, I think, is that people with schizophrenia share a common humanity with everybody else, and we want what everybody else wants. And the words of Sigmund Freud, to love and to work. That's what makes our life meaningful and our life good. And it's the same that makes your life meaningful and your life good. And the common humanity we share is much more important than the mental illness that we don't share. I mean, and another thing I'd say, if you hear nothing else, hear this, that there aren't schizophrenics, but there are people with schizophrenia, and we may be your spouse, we may be your child, we may be your sister, we may be your friend. So keeping that in mind, I think, is also important.
Right. And I guess the other, I mean, for us, and then for those people who are suffering from mental illness, to be able to feel like they can, you know, live, that they don't have to hide. What a shame for people to have to hide. Right.
It really puts
it is pathetic.
Barrier between yourself and other people, and it's terrible.
It really is. I taught special ed a long time ago, and I had a mother. I had a boy in my class.
I'm not. You're breaking up. I'm not hearing you.
Okay. I taught special ed many years ago, and I had a young man in my class who was bipolar.
Okay.
And he would cycle constantly.
Wow.
And it was tough because he was also a young teenage boy. So, you know, compound that.
Right.
And I remember one day his mother was looking for some resources, and she said to me, you know, I didn't ask for this.
Right.
But I am doing my very best to take care of him. And all I need is some help.
Yeah.
So what is that help looking like? Is it practitioners coming together? What is it? What is the help that is necessary?
Oh, gosh, you know, I think developing treatments and administering treatments that work, like different kinds of psychotherapy and different kinds of medication, and empowering parents and siblings and so on to understand the illness and not to get scared and run away, to stay the course even when your loved one seems to be pushing you away. NAMI, I think, helps a lot of people. The National Alliance on Mental Illness, they have branches all across the country. And they do programs where family members educate other family members about the illnesses and the issues that are raised by the illnesses. It's like a whole bunch of different things that are going on and that we need to do.
Mm-hmm.
Again, the big one, providing resources so people can thrive and do well.
So what? Oh, here's a good question. What is your most proud? Let's see. What is Dr. Saks most proud of in her life's work on mental health law issues?
I've been very interested in capacity to make decisions to participate in treatment and research, and I've developed an instrument to do that. And I'm very proud. I'm very proud of that line of work. And lately, I've started also studying, as I said, high functioning schizophrenia. The study with UCLA, where we have about 20 subjects, and we're looking at techniques people have developed to manage their symptoms. These are high-functioning people. What we're hoping is that we can design an intervention that will be both teachable and effective for, quote, lower-functioning people so that they can do better. And I'm doing another study at UCSD, which is also about high-functioning people with schizophrenia. So I'm very excited about that work and very proud as well. And as I mentioned, I'm writing a book with a bipolar lawyer, which will be another general interest book. And I hope that will reach, a larger population than my scholarly books would reach, and will also help people understand and help reduce fear and so on.
Yeah, I would think so. I think that's extremely necessary from where I'm sitting right now. And even just what my very quick entry into all of this since getting to know you through TED and reading your bio and all of that stuff and reading the chat. I think people don't know how to respond. We don't know what to do. We don't know, how can I talk to you? How can I talk to you?
So, people ask what should they do if their friend or family member becomes psychotic? And what I say is it's not one size fits all. So for me, having friends and family say, Elyn, it looks like you're really having a hard time. I know you're really scared, but it's your illness acting up, and we need to get you on more medication and to talk to your doctor, and we'll get through this. Just hang in there. That really works for me. I have a bipolar friend, a severely bipolar friend, and I said that to him, and he was furious. How dare you say that to me? So again, it's not one size fits all, but for me, support and understanding goes a long, long way to helping people. I don't think you want to challenge people's delusions. At the same time, you don't want to, pander to them. But you want to kind of speak to the healthy part of the person in a kind of kind and caring and supportive way.
Mm-hmm. Yeah, because you don't know. You don't know what's going to trigger. You don't want to.
I'm really sorry you're breaking up again.
You don't want to say anything that's going to trigger somebody. People want to. They don't know how to respond. They don't know how to care. They don't know how to care for someone.
Okay, so, all I heard was they don't know how to care for someone.
Okay, they don't. Okay, they don't know. People don't generally know what to do.
Yeah, no, I agree with that. People get confused. They get scared. They don't know what to do. They run away.
Right. And I believe that this book that you're coming out with is going to really answer a lot of that for the layman, for the family.
So.
I have a feeling. I have to tell you, I have a feeling it really is, because you really don't know, and so many people are thrown into it without having asked for it, like this woman. And then, where do you go from there? And the resources are not adequate.
Right.
Even mental health professionals, I don't think, are they're not holistic enough. I don't believe.
Right.
I think we're not, covering the surface enough.
Right.
So what else would you like to share with us in the next few moments that we have left with you? And we don't have that many, which I don't know, it went so fast. Yeah. But what else would be imperative for us to know? What else can you share with us?
I guess just, try to keep an open mind and be there for your friends and family who have mental illness. Don't get scared. Don't run away. Stay the course. I guess, and for sufferers themselves, get a good treatment. It's really important. And if you do, it can make your life much better. And there are resources for people who can't afford private care. It's not as good as private care. It's not as extensive, but it's available, and you should take advantage of it. And don't think of a diagnosis as a sentence to a bleak and painful life. There is hope. That's what I would say. There's hope.
Here's state funding for mental health services often is the first to get cut in a recession. Why is this so devalued?
I mean, it's a good question. Maybe there's not funding because people just don't value people who have mental illness. They marginalize them. They make them other. People say that that's true not only for resources for care, but resources for research. You know, how many research dollars go to mental health, given how prevalent it is and what the burden of disability is for people with mental illness. So it's just stigma rearing its ugly head again, and I think there's a lot to be said for that.
Mm. Yeah. Well, let me ask you something. So there are people in, let's say in my life, I'll use myself as an example, who I really feel like have some mental illness.
Right.
Maybe not extreme, but definitely whether it's being narcissistic or something.
Right.
How do you live, not just live with these people, because maybe they don't live in your house, but how do you kind of put up with it? You know, maybe it's the screaming.
I have to ask other people than that because I'm the one who's being put up with.
Okay.
Yeah.
Yeah. Okay, gotcha.
Yeah, I don't really know the answer.
Okay. All right. Well, I really appreciate so much your sharing all of this with us. And so are you going to be doing more talks? Are you speaking around or?
You know, I only have two other speaking gigs. One is going to be in San Diego, and one's going to be in Manchester, England. And I get a lot of invitations to speak, and I mostly say no because it's just too much wear and tear. But I do have those two scheduled.
Mm-hmm. So if people out here are interested in doing something immediate, is there something that they can do, someplace they can go, some way of supporting you and your work?
Well, my institute always welcomes donations, of course. You know, this year we just had our distinguished lecture last Thursday, and I think our symposium will be either the 10th and 11th of April or the 11th and 12th. I'm sorry, I don't remember. And the topic is criminalization of mental illness. That's to say people ending up in jails and prisons instead of hospitals and other treatment venues. Mm-hmm. So we're going to have mental health law professors and psychiatrists and consumers and a judge and a police officer and try to deal with that issue, and everybody is welcome to come. It's open to the public and free. Obviously, you know, not that many people actually live here, but that's my passion right now is studying, you know, the issues that my institute studies each year. The first year was mechanical restraints. Last year was psychotropic meds in the law, and this year is criminalization of mental illness. Next year is going to be mental illness and trainees in law and medicine and psychology, what the posture of school should be, what the posture of the student should be, and that kind of thing. Probably the year after that, we'll be doing veterans and mental health law. Yeah,
you'll probably need to do veterans.
Yes.
You know, and I know that here I read a study in North Carolina about how many kids were in college. I mean, they make it through high school, but by the time they get to college, they're committing suicide.
Yeah. Terrible problem.
It is a terrible problem. I mean, and certainly there's many reasons, but they make it through high school. How come they make it through high school and by the time they get to college they just can't do it?
Well, that's around the age when people start having serious symptoms.
Ah, I hear it. I gotcha.
Yeah.
I see. That makes sense.
Yeah.
And the colleges are not adequate in their support of these kids.
I actually see colleges really just trying to push kids away. You know, that there are suggestions that when kids get too thin, they're withdrawn from school. There was someone who checked herself into hospital for suicidal depression, and 2 weeks later went back to her dorm room, and the lock was changed. Maybe because of liability concerns, a lot of schools are not supporting kids the way I think they should.
Mm.
And that will be our subject next year. a part of our subject.
So when you do these subjects and you spend, I think you said, if I understand you correctly, you spend a year on a particular, then what do you do with it?
Well, we have a distinguished lecture in the fall and a symposium in the spring, and we attach students to the Institute, try to get them all publications, which we're being pretty successful at getting publications for students, and publishing the proceedings of the symposia in books, which we're just getting together a proposal in the first year for an edited book. And our hope is, to become kind of the go-to place that policymakers turn to when they're addressing issues that we study. So that's the basic concept.
Okay. And then earlier somebody was asking about the Saks Center at USC is focused on policy reform in California or nationally?
Nationally.
Nationally. Good to hear that. Good to hear that.
Yeah.
Great. And then I had a colleague of mine earlier today who could not make it to the show, but she saw us posting and all that kind of stuff. She asked me to ask you if you knew Oliver Saks.
Yeah, I do. We have the same last name, but we spell it differently. I love Oliver. He wrote a blurb for my book. I've written a blurb for one of his books, or a book he contributed to. And I love Oliver. I think it's so wonderful the way he can take kind of divergent ways of thinking and make them real and understandable and accessible to the public. He sort of really helps us understand normal reasoning by highlighting some of the, eccentric reasoning, if I can put it that way, that some people sometimes have. He had a brother who had schizophrenia. I think he's no longer living, but he had that in his own life with his brother.
So it made him more compassionate.
Exactly.
Chris says, as someone who loves someone with DSM, TV diagnosis, I especially thank and appreciate you for your courage, your academic contributions, your passion, and for sharing yourself with us.
Oh, thank you. That's sweet.
And Debbie said, thank you for speaking out to assist the mentally ill who are mistreated.
Yeah, thank you.
I have to say that, when people want to know what your passion is, first thing they'll say is, what pisses you off the most? For me, anyway, and I would always answer the people who can't really speak up for themselves. And it's always been people with mental illness or disabilities in one way, shape, or form or another.
Yeah.
So I really can't stand to see people bullied and people not taken care of properly, and So I really appreciate you, of all people, stepping up and stepping out and kind of putting a ganache on it, because people need somebody like you to stand up and do it.
I have a friend, a really close friend and colleague, who teaches at University of Louisville Law School, who has bipolar illness and has been public. And I think, that's really, his name's Jim Jones. He's really helped a lot of people as well.
Well, maybe we can have him on, because honestly, that's
sure.
We'll connect. Maybe we can connect with you on that, because I honestly love. I know that sounds correct. I mean, but there's such gifts honestly, there's gifts in mental illness. And a lot of people with bipolar, I've seen such extraordinary creative talents.
Right.
And
Kate Jameson, who's herself bipolar and is a psychologist at Johns Hopkins, has written a book called Touch with Fire about all the people with bipolar illness who've been creative geniuses throughout the years.
Yeah.
It's not the same with schizophrenia, but bipolar, a high degree of creativity.
And so what is it with schizophrenia? Is there a certain
Not
thing?
Really. Most people don't do well. Or many people don't do well. I mean, you kind of lose IQ points when you become schizophrenic, in a way.
Well, you have definitely educated us this evening.
Okay, well, thanks.
So thank you so much for being here, and I know that we're going to connect with you again, if that's okay. Maybe you can give us some of these names of some of these other colleagues of yours. We'd love to have them on, and I want to thank you so much. And
well, thank you for having me and for the good questions, and thanks to your audience as well.
Thank you. And I thank you all out there for being with us tonight and sharing this extraordinary evening with us. And it's a wonderful way to begin a week of Thanksgiving. So thank you all. Thank you so much, Dr. Elyn Saks. It's been a pleasure. And all of you out on the chat, wish you a wonderful week. And we look forward to seeing you next week. Take care. Bye-bye. And thank you so much. You've been great.
You are tuned to the Nissan Communications Network. Our weekly lineup of call-in programs includes Computers 2K Now with Amnon Nissan, Sundays 9 a.m. to noon. Health In with Debbie Brooke, Mondays 11 a.m. to noon. The Scope of Things with Marilyn Shannon, Mondays 7 to 8 p.m. Breaking Free with Marilyn Shannon, Mondays 8 to 9 p.m. Body Talk with Cindy Prince, first Tuesdays 8 to 9 p.m. Reawaken Your Brilliance with Julie Seibert, Wednesdays 8 to 9 p.m. And if you tuned in too late, you can always watch each program in its entirety or download an MP3 audio file of it at www.nissancommunications.com. Sponsored by thatvidblasterguy.com, CarolinaApparel.com, and DeltaForce.net.